Here's an introduction of how Medicare works. Basically, these are the parts of Medicare that you need to understand. Medicare A and B, Part C, Medicare Part D, and Medicare Supplemental Insurance, also called Med-Subs, or also referred to as Medigap insurance. Okay, Medicare, original Medicare, which is your Medicare A and B, covers 80% of all your medical expenses. In regards to Part A is hospital, Part B is outpatient. Medicare Part D, and we'll come back to C in a minute, Medicare Part D covers your prescription drug card, which is your over-the-counter prescription drugs. When you're in the hospital, your Medicare Part B covers your prescription drugs. But this is your RX card for over-the-counter medications. Now, Medicare Supplement covers the 20% that Medicare does not cover. It's also called Medigap insurance because it covers the gaps of original Medicare. So if you have a Medicare, original Medicare, and a Medicare Supplement, essentially you'll have 100% coverage if you choose Plan F, which is one of the plans of the Medicare Supplement plans, which I'll explain in more detail in a few minutes. So basically, you also need to add an RX card or prescription drug card to have complete coverage. So you'll have your hospitalization, inpatient, outpatient coverage through your Medicare Supplement and your original Medicare, and you'll have your prescription drug coverage through a standalone Medicare Part D card. All right, now here's what Medicare Part C is. It's also called a Medicare Advantage plan. And basically, Medicare Advantage plans work like this. Medicare takes your 80% coverage, turns it over to a private company who administers your 80%. So basically, your coverage for Medicare is gone from your primary insurance being original Medicare to whatever private company you choose, whether it's Humana, Blue Cross, United Healthcare. Okay, with this private company, you will make up for the 20% in the form of co-pays and co-insurance. And these plans can vary from anywhere from, say, 25 or 30 co-pays up to maybe 50 or 60 co-pays or co-insurances, depending on which plan you have. Also, your Medicare allows a plan to charge you out of pocket up to $6,700 per year before it pays 100%. So as opposed to a supplement plan, you essentially have 100% coverage from day one with a Medicare Advantage plan, and it depends on which plan you have. The out-of-pocket expense varies, but Medicare does allow companies to charge you up to $6,700 before you would have 100% coverage. So there's definitely a bit more liability in the Medicare Advantage plan if you get sick and need it and actually start using the benefits. So that kind of gives you a quick overview of Medicare. I'm going to get into what specifically the Medicare supplements cover and how they work.